Infection is bad enough, but contending with chronic sinus infections can be a real problem. Staying on antibiotics isn't good for the body, leaving patients with very limited options.
Yeah, and for those people, an office-based procedure that doesn't involve any cutting may be just what the doctor ordered. Wheat News Health and Medical reporter Amy Osher explains.
For going on 40 years, Virginia Williams battled one sinus infection after another.
The fatigue that comes with chronic pain is pretty debilitating.
The last 2 years, the pressure in her head was unrelenting.
It was like every month and a half, a different antibiotic. Nothing was working.
Her issue, while severe, is something doctors see quite often.
How common is this condition?
Chronic sinus affects about 10 to 15% of people in the U.S.
Naples ear, nose, and throat specialist Dr. Matthew Connor deals with these chronic cases.
In some people, chronic sinus infections can develop into severe infections that may involve their eye or their brain.
This is a CT scan of Williams' sinuses.
All this grayed out area is just infection.
In the past, doctors often opted for surgery to clear out troublesome cavities. Now there's a less invasive procedure called balloon sinus dilation that does the same thing.
We've been able to bring that same technology that we use in the operating room and put it in the office, so we can be very precise and accurate with the balloon.
This is the balloon. It sits on the tip of a catheter sliding into the nose and inflating with saline to open the space. Doctors can insert another tool to clean out any stagnant infection.
Being able to open up those sinuses, people are not only going to help get over their sinus infection they're currently dealing with, but also help prevent future infections from forming.
Williams underwent the balloon procedure in September.
I haven't had any sinus headache since then.
Spending less than an hour in the office cleared up years and years of suffering. Amy Osher, Wink News.
That's impressive. Now, because this doesn't involve any incisions, patients are awake with a numbing agent, kind of like what you would get at the dentist, and there's no downtime for recovery.